Welcome to the Live Greater podcast series, information for a healthier you from the University of Maryland Medical System. I'm Evo Terra. At some point in time, you've probably had a wound, a cut finger that was fixed with a simple bandage, or something that required stitches like a surgical procedure, and it probably healed fine. But that's not always the case. To help understand how to treat hard-to-heal wounds, today I'll talk with Dr. Sherif Osman, MD. He's the medical director at the University of Maryland Medical System. Dr. Osman, welcome to Live Greater.
Hi there.
So what makes a wound hard to heal? And what qualifies as that word, hard to heal?
So we classify these wounds as chronic wounds or problem wounds. These wounds are wounds that fail to heal as we would expect any wound to heal. When anyone develops a wound, it goes through different stages of healing, starting from the stage where the blood clots and the wound starts to seal, all the way to when the wound becomes completely healed and scar tissue forms. Any of these stages, when they're disruptive, can result in a wound that fails to heal and becomes chronic.
So what do we do with wounds? What do you do with wounds, I guess I should ask, that won't heal? How are they typically treated?
So oftentimes these wounds that I see have already been seen by other physicians and have failed to heal. They've often been treated with antibiotics or surgery, and despite that, they've continued to be problematic. So the first thing that I do is try to determine the reasons for the wound not healing. The most common problem wounds occur after surgery, where there's dehiscence, which means the wound fails to heal and reopens, or after radiation, or after burns, or after wounds that develop in patients who are diabetic, patients with poor circulation. Autoimmune diseases often results in wounds that fail to heal. Patients that are malnourished or have cancer. Chronic edema in the legs, the swelling, is a big problem for patients who have venous insufficiency in varicose veins. And sometimes I even see animal bites.
Wow. Sounds like there's a lot of things that can cause this. One thing I know will never cause it, though, is having a mole removed from your back on your shoulder area and getting stitches in it and then going out to play golf 2 days later. That would never cause this problem, he said from experience.
Actually, I've seen this problem quite a number of times.
I've seen it once, and that was enough for me. I don't want to do any more of that. Oh, well, let's talk about this for a second. I mean, there are lots of things where I want to get to, but clearly if we've got a wound that's not healing, people can't be with their doctor all the time. They have to somehow dress and treat this wound on their own. How often should we be changing dressings on a wound that cannot be healed?
Well, first of all, besides determining the cause of the wound, if there's any dead tissue that is on the wound, that's one of the first things that has to be removed. The dead tissue attracts bacteria and infection and causes inflammation, which results in poor healing. So we do things like surgical debridement, which means removing the dead tissue, and then we use specific specialized topical antibacterial dressings. These dressings over the last 10 to 20 years have become very sophisticated and are impregnated with things like ionized silver and other antibacterial products that kill bacteria without harming the new growth that occurs on the wound. And these dressings can typically last anywhere between a couple of days all the way up to 7 days. And all that depends on the amount of fluid discharge from the wound. And so the more fluid, the more frequently the dressing needs to be changed.
Right. One thing that strikes me as we were talking about this is I'm assuming that there might be people out there listening right now who are thinking, hey, I've just had surgery, I've got this incision, or I just had this thing happen to me. Is there something we should be doing if we do have a wound so that we could do to maybe facilitate faster healing or something to prevent a wound from becoming hard to heal?
Well, most surgical wounds and acute wounds heal just fine. And often the treatment that's prescribed by the surgeon who performed this procedure is more than adequate to heal the overwhelming majority of wounds. These types of wounds that result in poor healing, like I said, require more attention, and the key is to determine what is the cause. In a diabetic patient, it could be uncontrolled diabetes, or it could be an infection that requires antibiotics. The key is keeping the wound clean and following the instructions given by your physician.
And if we're feeling something's not right, if we have this wound and I guess my question is, when should someone seek out help if they think they might have a wound that is becoming hard to heal?
Well, like I said, most wounds very easily in the way that we would expect them to heal. If you see a wound that's getting larger, if there is significant inflammation surrounding the wound with redness and tenderness, increased discharge, bad odor, increased pain, that's the time when it's time to seek further care.
And if it is time for further care and something is done medically to help with this from all the things you mentioned, assuming this isn't always at least a one-time treatment and you're good to go, this might even require several visits. Can you shine some light on that for us?
Sure. Most of the time when we see chronic non-healing wounds, we often have the patient come back every 1 to 2 weeks to evaluate the efficacy of the treatments that we've prescribed and make sure that things are heading in the right direction. Oftentimes, we have to make modifications in the treatment plan depending on how that wound progresses. And sometimes we even have to use things like compression bandages, for example, in patients who have a lot of edema in the lower extremities, which is a major cause of non-healing wounds. And these oftentimes need to be changed on a weekly basis.
Sounds like there's no one-size-fits-all approach to any of this. There's a lot of underlying factors, and then, as you said, what is the cause of this wound and why won't it heal in the first place?
Exactly. And it's so vast, and that's the thing that I enjoy so much about wound care is the complexity of it and the fact that there are so many different treatment modalities that are effective in caring for chronic wounds.
Any other takeaways for our listeners?
If you have a wound that fails to heal in a way that you would expect it to heal, ask your doctor for referral to a wound center. The wound centers specialize in healing complex non-healing wounds. This is what we do best. We do it day in, day out, and we see every kind of wound you can possibly imagine.
Doctor, thanks so much for sharing your time and knowledge with us today.
Thank you.
And once again, that was Dr. Sherif Osman, the medical director at the University of Maryland Medical System. Find more shows just like this one at umms.org/podcast and on YouTube. Thank you for listening to Live Greater, a health and wellness podcast brought to you by the University of Maryland Medical System. I'm Evo Terra, and we look forward to you joining us again. And please share this on your social media.